Good morning, everybody, and welcome to this breakfast briefing. We're delighted to be streaming live from our new office for the first time. And today we're going to talk about the added value of patient organizations. And indeed, next Tuesday, on the 14th of November, we'll be releasing a major publication on the added value of patient organizations that's been written by Dorota Sienkiewicz and Corinne van Lingen. And to talk about this, I have invited one of the authors of the report, Dorota Sienkiewicz. Welcome, Dorota.
Good morning, Camille.
How are you doing?
I'm doing really well. I'm really happy to be here.
Good. Before we start our conversation, I wanted to give a brief account of the reasons that motivated us to commission this report. So indeed, if the added value of patient organization is very clear to us as a patient community, it's not necessarily very clear to all of the target audience of EPF, meaning national and European decision makers, payers, academics, health professionals, and industry. Or sometimes we note that external stakeholders may have an understanding of one of the roles of patient organization, but they don't have the full picture. So our objectives with this report is really to highlight the many dimensions of the added value of patient organizations and to profile patient organization as a legitimate stakeholder on the health scene. So to make sure that the health community makes the most of what patient organizations have to offer. So that's our objectives for today. So Dorota, I just want to give you the opportunity to say a few words about you and also about the methodology of this report that you used.
Yes, so my name is Dorota Sienkiewicz, and as you already mentioned, I'm one of the authors of the report on the added value of patients' organizations. And I'm working as a freelance researcher and report writer, but my background is in public health network organizations. I used to work for a couple of organizations based here in Brussels in the field of health inequalities and determinants of health, among others. The report, the methodology that we used with Corinne, so the other author, was very much based on desk research. So we did a lot of reading and looking around what the main European institutions have to say about their understanding of the added value of patient organizations, what the academia has to say, and other we call them horizontal stakeholders, so stakeholders from the public health community here in Brussels. And we also made use of the results of the survey run by the European Patients Forum among their members, and interviews with key stakeholders, institutional stakeholders, and also civil society stakeholders on the issue.
So the first challenge that EPF wanted to address with this report was really the confusion around the very definition of patient organization. So we noticed that patient organizations are sometimes confused with foundation, charities, support groups, and there is really no clear definition among the broader public of what a patient organization is. How did you solve this challenge, and what is the definition of patient organizations that you used in the report?
Right, so that's indeed the case, and we also came to this conclusion that there's really no universally used definition of patient organizations. It doesn't exist. There is more or less a common understanding. We used a definition that's been produced by the European Medicines Agency. The definition was developed in a consensual way, so in a consultation with wider community. I can of course quote it. We use the definition that says that patient organizations are defined as not-for-profit organizations, which are patient-focused and whereby patients and or the carers, so in case patients are unable to represent themselves. So this position is being taken by the carers.
That's the case for Alzheimer's patients, for example.
Yeah. Yes. So then they represent the majority of members in the governing bodies.
Okay. Good. In the report, you also dedicate one section to the differentiation of patient organizations from other NGOs. What makes them unique, in your opinion, and after writing the report?
Yes, so there is a very big emphasis put on the uniqueness of the patient organizations as being slightly different from the rest of the health community, health NGOs, and this point also came very strongly from the interviews that were conducted with the key stakeholders, where they really wanted to emphasize the fact that patient organizations are organizations with a strong human focus, working for and with the people they represent. Another point that was made was on the representativeness and making sure that the voices that are channeled vis-a-vis the other stakeholders are really based on the real understanding of the needs, concerns of the populations that patient organizations serve.
Okay, thank you. Now coming to the meat of the report, when the general public is asked about the roles of patient organizations, the first thing that comes to their mind is either the support that they bring to other patients, so pulling the experience of other patients and maybe giving references to medicines and so on, or it could be also the role of patients in pharmaceutical research, so clinical trials and so on. Yet the remit and the actions of patient organizations, and I'm speaking as a representative of one, is much wider than that. What are, according to the report, the main roles of patient organizations?
Yes, that's true when you talk to general stakeholders, I would say, even general public, people working for the institutions, or even people representing other organizations within the health community. The very obvious response that you hear from them on the role of the patient organizations themselves is service delivery or exchange of information, informing patients about the clinical trials, etc., etc. But as the report shows, the role of the patient organizations is much broader, embraces really significant input towards policy making at all the stages of policy processes, and it's not only the health policies or the health systems organization, I don't know, medicines pricing, etc., etc. So also the pharmaceutical policies, but it's much wider than that, and that's actually I would say a beauty of this type of organization, also showing, emphasizing the impact of many other EU policies from outside the health sector on realization of the needs, daily living conditions of patients living in Europe, whether it's Belgium, Poland, Sweden, Czech Republic.
So compiling the experience of a body of patients, of individual patients, and making them a community experience.
Yes,
a community voice.
And coming to talk vis-a-vis the decision makers with a unified a single voice on what it is to live with a certain condition, with a certain disease, and this not only being reflected then in, as I already mentioned, prices of medicines, but also the preventative side of health-focused interventions, or much wider, so the EU budget, whether there is money going towards social inclusion of patients, or re-employability and issues like that. So that this whole health in all policies approach is very much present in the way patient organizations work. So that was the policy aspect. The report, almost naturally coming from that, touches on the issues of advocacy. Also coming together in a unified, organized way, in a coherent way, and making sure that the issues that were discussed as a consensus issue then are being presented, and making sure that these issues are heard at all levels of policy making of different governmental bodies.
And there's the added value is really for decision makers, because they don't have to consult with 5 different disease-specific organizations or 10 or 15, but they can just talk to a national coalition or a European disease-specific organization to know what the voice of patient with asthma is, or the voice from patients from Poland, for example, rather than talking to a variety of people.
Yes, and that really makes a difference, I think, for already busy decision makers who, I think, for cost effectiveness of the time, this is what they are really looking for.
So that's for policy and advocacy, and you highlight 4 different roles of patient organization in the report. Yes. What are the other?
The others are peer support. You already kind of mentioned that a little bit. It's providing either emotional, organizational, and also legal and financial support to either individual patients or formally organized organizations where they are, for example, setting up themselves when they wish to get more professional, to gain also in credibility. So this is also a strong focus of many patient organizations. Another role that we researched with Corinne is also participation in research, and it's not only the usual suspect pharmaceutical research, as I would call it, so participation in clinical trials and issues like that, but also the general health research going in the direction of social, so that the issues...
Yeah, and sustainability of healthcare systems, and that's the aspect that you mentioned in the report.
Yeah.
Okay.
And setting up research priorities as well, before even the research is being executed at different stages. Yeah.
So,
yes.
So did we mention the 4 of them already?
No. There is another one that's really very important. That's the education that patient organizations provide across the spectrum, be it individual patients that are members of their organizations, members of their members. So I would say kind of education inward, but also education to all the other health, non-health stakeholders in institutions, the media, the academia, general public. Did I mention all of them?
Yeah. Okay. So to sum up, we have policy and advocacy, capacity building and education, research, contribution to research, and not only pharmaceutical research, but health systems research, prevention and definition of research priorities, and peer support. That's the 4 main roles that you identified.
Yes.
Thanks. What, according to you, are the biggest misconceptions when it comes to patient organizations?
I think the issue that I already mentioned, that some of the issues that I already mentioned, that external stakeholders or stakeholders who are not very familiar with the way patient organizations work or civil society in general works, is that they exist purely to deliver certain services.
Mm-hmm.
So there is this very much kind of tokenistic attitude toward patient organizations. They are just there to take certain boxes. Yes, we involved representatives of the patient community, and that's the main or the only purpose patient organizations serve. So that's a really big misconception that other stakeholders hold, or that they spend their time on a daily basis, for example, to referring patients to participation in clinical trials, all those issues related to pharmaceutical research. So to me, it seems like there is a lack of understanding of a variety of the roles fulfilled by patient organizations.
And also of the professionalism maybe of patient organizations, because I think the general conception is, I don't want to push words in your mouth, but that's what we notice at EPF as well, is that the general perception of the public is that patient organizations are not necessarily very professional, and that's not what we see when we deal with our members. On the other side, we also see that some organizations rely mainly on the work of volunteers, and that's another challenge. But that provides with a transition, a nice transition to the next part of our conversation, which is about the challenges, because you have a whole section also of the report focusing on the challenges that patient organizations meet and that prevent them from delivering the added value that they have. So what are these challenges that you identified?
Yes, thank you, Camille, that you mentioned the professionalism and then the related representativeness to that, and relying many times on the work of the volunteers that make the work of patient communities happen. That's indeed one of the challenges that we identified in the report, and I think that's the case for most of the civil society, I would say, in Europe, that they are being seen or understood as a bunch of people coming together for a good name, wanting to do something great, and that's true. However, the external stakeholders may see them as lacking in what you called professionalism,
and credibility, therefore.
Credibility and questioning the expertise on many issues, including knowledge of policies, policy cycle, especially here in Brussels, I would say, but also at national level as well. The credibility issue also comes up quite high. People don't understanding the fact that the patient organizations are legitimate partners, legitimate actors in health policy design, implementation, evaluation, etc. processes. And I think it comes from difficulties in really measuring the real value of civil society as such, patient organizations definitely, in what it is exactly that makes them just bring the difference to how the policies would be made if they weren't there. And I think it's of course related to the question of quantitative versus qualitative research that's being valued in general in evidence-based policy making. There has been a lot of progress already made, that decision makers started understanding that there is something that you can't really capture in relation to the added value. Nonetheless, they do involve and engage slightly better than it used to happen before.
So are you saying that a way to measure the added value of patient organization would actually be to not involve patient organization and see what happens, so see the non-impact of patient organization?
I think that would be a very tricky, dangerous experiment. No, they are in the research area. There are, of course, various methods that you could use to make like foresight models and those things that you could use to really try to capture it to a better degree than it's right now.
The resources issue is also comes up also quite prominently in the report. I mean, we don't have to spend too much time on resources because that's a clear obstacle. I mean, you can explain a little bit, but I wanted to come to the point of the lack of perceived lack of independence from funders and especially from industry, which is a big challenge for patient organizations and for their credibility. How do you think patient organization can overcome that challenge?
Many organizations already have overcome the perceived lack of independence from some of the funding or some parts of the funding coming from the industry sector. But yes, that's true. I mean, nowadays, and it's been with us for some time already, especially in the times of the economic crisis, I could say it's still probably ongoing, that many NGOs, health NGOs, have faced turbulent times in obtaining the funding, securing and making it sustainable. And yes, that's true. Some of the organizations do accept some funding from the industry, but for those reasons, many organizations also came together and developed strong guidelines to guard themselves against lack of transparency, lack of independence in the final outcomes. They have governing bodies that oversee the processes, so there are ways to do that. As I already said, many patient organizations already have done so to a good outcome, good results.
Okay. Any other challenge you want to mention while we are? tackling this issue?
Yes, if I could choose just one, I think there is, for the external challenges that exist there, so the systemic issues that are of course much wider than just having an impact on patient organizations, but for the whole NGO community, I would say there's a lack of legally recognized right of the third sector, the civil society organizations, patient organizations, to participate in a systematic way in all the political, financial decisions that are being taken at the highest level. Even, I mean, organizations are part of the different stakeholder advisory bodies, expert panels, round tables, etc. But the picture of this being officially written in different regulations, be it at the EU level or national level, is quite patchy. And I would, if I may, I would say, perhaps even more so in the new member states who have relatively new history of engaging with civil society in policy making, in decision making processes. So, but even here in Brussels, there's no real culture of engaging patient organizations in really early stages of talking about how a certain policy should look like, where the money should go to.
Good, thanks. Did you learn anything in this while writing this report that surprised you?
Yes, there was one interesting thing that I kind of suspected for some time, but it was interesting to really read it in various articles. Was a connection between increased professionalism of patient organizations and potential threat of lacking in representativeness, so the real connection to the people organized patient community then would be supposed to speak in the name of. So that was quite interesting, and I think there is a point in it, a certain level of truth, that when organizations get bigger and bigger and bigger and get more and more credible and are being valued for being professional and a real experts in their field, they may rely on the views, opinions of a really a small group of experts in their field, whose opinions might not necessarily be very much up to date with the changes that happen on the ground.
But it's a difficult balance then for patient organizations, because they rely, and we see a lot of our members rely on volunteers. They try to get for lack of resources as well. Right. So they try to get the resources. Want to get the resources and have the ability to hire a staff member, for example, and grow their organization. Then they are accused of lacking representativeness. So it's a difficult balance, and this is something we see also with our members. But I think bigger organizations also are aware that the lack of representativeness would be potentially translate in a lack of credibility, and are very careful about that. That's my impression as a member of a patient organization. But
yeah, I think just a way to try to overcome is to speak about it openly, and try to emphasize the potential reasons behind that. I mean, it's not the case. It's not the case for everybody. It's just there is just this underlying threat of indeed being accused of that. It doesn't have to happen.
Coming to the last section of the report, you formulate recommendations to different stakeholders, so including European national decision makers, research and academia, that could enable patient organizations to play their role. What are some of the steps that could easily be taken from all the stakeholders to benefit from this added value of patient organizations?
Right. Yes, so there are some specific recommendations that we would gladly, you would gladly want to see being taken up by certain stakeholders. But there are some, as I would say, low-hanging fruits that could be within the reach of everybody to start with, to see the real value of patient organizations in various areas. One of those is acknowledgement of the fact that all stakeholders, including patient organizations, should be treated on equal footage, because they are legitimate partners in the policy processes. They have the right to a duty, very much often, so to represent and voice the concerns of the populations they serve, and very often so it's those who are most stigmatized and marginalized in our societies, and that includes also participation in the financial compensation. You said many of your members are just working pro bono, and they are volunteers, and I don't think it's unacceptable that they shouldn't be excluded from. They should be excluded from those compensation processes, while everybody else is not. So, so that's number one. The issue of funding. Accepting the fact that some funding from industry does not necessarily mean lack of independence. And I already mentioned that there are really strong guidelines that can be developed by patient organizations to guard themselves from being seen as such. Challenging this institutional culture of tokenistic approach towards patient organizations. I think that's one of the issues that we all could really do. Just basically talking about it and uncovering this on a daily basis in all the relationships that happen out there. Capacity building with patient organizations, treating them as partners, where everybody can learn something from each other, investing in people, in relationships, and in ways of engagement and facilitation of the dialogue that happens and goes in between all the decision making that takes place.
Okay, that's 3 actionable points for all of the stakeholders who are watching us, in addition to our members. Do you have a final word for our members on their added value and how they could promote it further?
I didn't think about it. Well, if I had to say something very in a compact way and directed to the patient organizations themselves, I would say do not let yourself being talked into that there is lack of the value, of the added value of the work that you do. Because that's not true. You can read it in the report and communicate it to everybody who does question your right of participating and demanding to be at the table when decisions are being taken. And just taking the space that's there in an organized way and loudly, because if not, then there is always somebody else who is going to take up that space instead of you. There are a lot of forces that just waiting to be included to a greater degree.
Thank you very much, Dorota, for this strong message. As I was saying, the report will be available on Tuesday, 14th of November, and you will be able to download it from EPF's website. In the meantime, on the 17th of November, we will have another breakfast briefing at 10 a.m. Kaisa Imonen, our Director of Policy, will welcome Dominique Monet, the head of the disease program on antimicrobial resistance, to discuss antibiotic resistance and how we could prevent it. I would like to thank my colleagues who made this breakfast briefing possible, Gilvina Scavena, Sarah Gayare, and Laurent Louette. Thank you very much, and thank you again, Dorota, for being our guest today.
Thank you.
Bye.